Over 60. This drug is silently destroying older adults' hearts. Cardiac surgeon warning. Senior health care. Let me tell you something that may startle many people over the age of 60. There's a familiar little pill, one almost everyone keeps in their home medicine cabinet, that is quietly weakening your heart day after day. It's not some rare prescription. It's the everyday pain reliever people take to ease the aches or calm inflammation, believing it's harmless. I'm a cardiac surgeon with more than 20 years inside the operating room, and I've seen far too many cases of heart failure, fluid-filled lungs, and dangerous arrhythmias that didn't come from new diseases. They came from the very medication people thought was safe. This isn't fear-mongering. The FDA and multiple major studies have been warning about this for years. So in this video, I want to sit down with you and walk you through exactly what this drug is, why your heart becomes more vulnerable after 60, and what you can do to protect yourself before it's too late. Section 1. The story and the problem. Why this video matters. Let me start with a story about a patient I met not long ago. A 70-year-old man, compact, energetic, the kind who loved working outdoors. He was never the type to complain about his health. Over the past few years, his knees and lower back had begun to ache, but like many older adults, he chose to handle it himself, a couple of anti-inflammatory pain pills each day, so he could keep up with his busy routine. He believed they were mild, harmless medications, the kind everyone takes sooner or later. But one afternoon, as he was bending down to tend his plants, he suddenly felt short of breath, a heavy pressure across his chest, and a swelling in both legs that appeared almost instantly. When he was rushed to the hospital, we discovered he was in acute heart failure. His heart could no longer pump effectively, and fluid had begun to fill his lungs. His family looked at me and asked, "He's never had heart problems. How could something like this happen?" The answer wasn't a new disease. The real culprit was the medication he had been taking every single day. The very drug most people assume is completely safe. And that's why I need to speak up today. Many adults over 60 develop heart failure, high blood pressure, or dangerous arrhythmias, not because of new illnesses, but because of the everyday medications they never think twice about. The numbers are genuinely alarming. 60% of adults over 60 buy and use medications without knowing their cardiovascular side effects. 1/3 of them are taking at least one drug that can cause fluid retention, raise blood pressure, or trigger abnormal heart rhythms. The reason is simple. Once you pass 60, your body changes dramatically. Your heart stiffens and loses pumping flexibility. Your kidneys filter less efficiently. More fluid gets retained. Your blood vessels lose elasticity. Blood pressure spikes more easily. Your heart's electrical system weakens. Arrhythmias become more common. And it takes only one medication that increases salt and water. Retention tightens blood vessels or disrupts electrolytes to push the heart into danger. And the group of drugs most responsible, the one found in nearly every household, is what we're going to talk about in the next section: NSAIDs, the common anti-inflammatory painkillers. Section 2. The drug silently harming hearts. After 60, NSAIDs, anti-inflammatory painkillers. Now we need to call out the main character in this story, the group of anti-inflammatory non-steroidal pain medications known as NSAIDs. You might not remember the term NSAID, but I'm sure you've heard, or even used. The familiar names ibuprofen, naproxen, diclofenac, and many others sold under different brand labels. These are the pills so many adults over 60 reach for when dealing with knee pain, back pain, shoulder stiffness, toothaches, or headaches. And because they relieve pain so quickly, it's easy to believe they're good, that they work well, and then use them for months or even years without thinking about the other side of the story. Mechanistically, NSAIDs work by blocking the chemical mediators that trigger inflammation and pain. It sounds perfectly logical. But here's the part few people ever get told: the same chemicals these drugs block also play a crucial role in protecting your kidneys and the lining of your blood vessels. When that protective system gets switched off, two dangerous things happen. First, your body begins retaining more salt and water. Think of your heart as a pump. When the amount of fluid in the pipes keeps increasing, the pump has to work harder day after day. A younger heart can handle that pressure, but after 60, when the heart has stiffened, the muscle has weakened, and the blood vessels have lost elasticity, that extra load can push the heart into failure, causing leg swelling, trouble breathing, and fluid buildup in the lungs. Second, NSAIDs can constrict blood vessels and raise blood pressure. If you already have hypertension, these medications can push your numbers higher without you feeling anything. Even worse, they can blunt the effect of your blood pressure medication, meaning you think your blood pressure is under control, but inside the strain on your heart and arteries is still dangerously high. There's another fact most people never hear: high-dose ibuprofen, diclofenac, and several other NSAIDs have been linked to an increased risk of heart attack and stroke. Enough that drug agencies in multiple countries have required cardiovascular warnings printed right on the packaging. The danger isn't taking 12 pills at once. The danger is the daily routine use. The just 1 or 2 pills a day habit. In a heart that has already crossed the age of 60. What I want you to remember is this. These aren't bad drugs, but for older adults, especially those with heart disease, high blood pressure, or reduced kidney function, they are no longer the harmless everyday remedies people believe them to be. And in the next section, I'll explain why the body after 60 becomes so vulnerable, even when the dose seems completely normal. Section 3. Why the heart after 60 is so easy for medications to attack. To understand why the very same medication that a 30 or 40-year-old can take without much trouble suddenly becomes risky after 60, we have to look at the silent changes aging brings to the body. Let's start with the heart. After decades of pumping blood nonstop, the heart muscle gradually stiffens and loses elasticity. The chambers, especially the left ventricle, don't relax and expand as easily as they used to. That means even a slight increase in blood pressure or just a bit more fluid in the body forces the heart to work much harder than before. Next are the blood vessels. As we age, the vessel walls slowly harden and lose their natural elasticity. If you imagine youthful blood vessels as flexible rubber tubing vessels, after 60 are more like rigid plastic pipes. When a medication causes the vessels to constrict or increases resistance, blood pressure spikes much more easily. One spike alone is dangerous, but repeated spikes week after week, month after month, slowly wear the heart down. Then we have the kidneys. The kidneys decide whether your body retains or releases salt and water. After 60, kidney filtration often drops, sometimes to just 60, 70% of what it was in youth, and you won't feel any symptoms. When the kidneys are already weaker, any drug that causes salt or water retention or reduces kidney blood flow, as many anti-inflammatory painkillers do, will make fluid build up quickly. The result is swollen legs, sudden weight gain, shortness of breath, and heart failure. Another piece of the puzzle is the heart's electrical system. With age, the wiring inside the heart becomes more prone to glitches, slow rhythms, fast rhythms, premature beats, atrial fibrillation. In this state, medications that disturb electrolytes like lowering magnesium or potassium or drugs that slow electrical conduction can act like a spark that ignites dangerous arrhythmias. And finally, many adults over 60 aren't taking just one medication. Blood pressure pills, diabetes meds, cholesterol meds, gout treatment, joint pain relief, stomach protection, sleep aids. One pill for this, one pill for that. Add painkillers, cold medicine, and supplements on top. Each brings a little side effect, and all those littles add up to a heavy burden on the heart and blood vessels. So the issue isn't simply whether a medication is strong or mild. The real issue is this: a heart that has already worked for 60.70 years is being asked to carry even more weight from pills that most people assume are harmless. And in the next section, I'll talk about another group of medications many older adults take every day to protect their stomach, but that can quietly destabilize the heart's rhythm. Section 4. The stomach protection drugs that can disrupt your heart rhythm. PPs, omeprazole, pantoprazole, esomeprazole. Now let's talk about a group of medications that countless adults over 60 take every single day without ever realizing they're actually strong drugs: proton pump inhibitors. PPIs, such as omeprazole, pantoprazole, esomeprazole, and lansoprazole. I hear the same sentences over and over from patients: "Doctor, this is just a stomach pill. I take it so I don't get acid reflux. It's harmless." Or "My doctor gave it to protect my stomach while I'm on other medications, so I just keep taking it to be safe." Here's the problem. These drugs were originally designed for short-term use, around 4 to 8 weeks. But in reality, many people use them for months, years, sometimes even for life without ever being reassessed. And here's what most people don't know. When your stomach acid stays suppressed for too long, your ability to absorb certain minerals, especially magnesium, drops dramatically. Magnesium is like the conductor of the heart's electrical orchestra. When you're deficient, your heart becomes far more prone to rhythm problems. Fast beats, erratic beats, skip beats, even dangerous fluttering. I once had a patient, a woman in her early 60s, who had been taking omeprazole daily for many years for reflux. During a routine checkup, her ECG showed very irregular rhythms. Her blood work later revealed her magnesium levels were dangerously low, and the main cause was long-term PPI use with no monitoring. It doesn't end there. Some studies suggest a link between long-term PPI use and increased risk of heart attack, possibly due to how these drugs affect nitric oxide, the molecule that keeps blood vessels soft and elastic. And for patients who have had a stent placed or previously suffered a heart attack, omeprazole may even reduce the effectiveness of clopidogrel, the essential antiplatelet medication that protects coronary arteries. What I want to emphasize is this: PPIs are not the enemy. But if you're over 60 and have been taking a stomach protection pill every day for many months, you should ask your doctor, do I really need to stay on this long term? Can I reduce the dose, take breaks, or switch to lifestyle changes instead? Should I check my magnesium levels or get my heart rhythm monitored? In the next section, we'll talk about a very common cold and nasal congestion medication, one that can quietly push your blood pressure and heart rate to dangerous levels. Section 5. The harmless cold and decongestant medications that can push your heart to the edge. Now we come to another group of drugs that people use even more casually: cold medicines, decongestants. The just take a couple pills when you're stuffy kind. Many older adults think it's just a cold. I'll grab something at the pharmacy so I can breathe easier. Nothing serious, but a huge number of cold and sinus products contain ingredients like pseudoephedrine and phenylephrine. You might not recognize these names on the label, but they have one thing in common. They are vasoconstrictors, drugs that tighten blood vessels. The mechanism sounds logical at first. When you have a cold, the blood vessels inside your nasal passages dilate and swell. Congestion, stuffiness, difficulty breathing. The medication constricts the vessels. Less swelling, easier breathing, better sleep. But here's the danger. These drugs don't just constrict blood vessels in your nose. They constrict blood vessels everywhere, not just in your sinuses, but also in your heart-brain, kidneys, arms, and legs. So what happens? Your blood pressure spikes. Your heart has to pump blood into vessels that are suddenly tightened, like trying to force water through a pinched hose. Pressure climbs fast. Your heart begins to race. These medications stimulate the sympathetic nervous system, the gas pedal. For a heart that's already weak or has a history of coronary disease, this can be the final straw. For some people, especially those with hypertension, heart failure, coronary artery disease, or arrhythmias, just a few days of cold medicine containing pseudoephedrine is enough to trigger skyrocketing blood pressure, chaotic heart rhythms, and even emergency hospitalization. I've seen it many times. Someone in their 70s with a mild cold, sneezing a little cough, walks into a pharmacy, buys cold medicine without mentioning their medical history. By day 2 or 3, they develop pounding headaches, dizziness, rapid heartbeat, and blood pressure readings dangerously high. When we check their cold medicine, we immediately spot the culprit: vasoconstrictor ingredients. The key message I want you to take away is this: if you're over 60, especially if you have high blood pressure, heart disease, or a history of stroke, avoid cold pills that contain pseudoephedrine or phenylephrine. Instead, you can use saline nasal sprays, humidifiers, steroid nasal sprays prescribed by your doctor. These work locally and have far less cardiovascular impact. Don't let a mild cold, something that normally requires rest and simple care, turn into a heart crisis because of a few easy breathing pills. Stop for 10 seconds to protect your own heart. If you're starting to feel a little alarmed by how familiar all of these medications sound, that's actually a good sign. It means you're taking control, not leaving your health up to chance. I want to ask you for 2 small actions that can make a massive difference. 1. Hit subscribe and turn on notifications. In the videos ahead, I'll break down more medications, foods, and habits that seem harmless but slowly erode heart health after 60. One click ensures you won't miss these essential warnings. 2. Os so. Share this video with at least one person over 60 you care about, a parent, spouse, relative, or friend. Your share today might be the reason someone avoids a dangerous spike in blood pressure or a future heart failure episode. Now let's continue. In the next part, I'll talk about a group of older antidepressants and even certain bone health supplements that many people think are completely safe but can increase the risk of heart attack when used the wrong way. Section 6. Old generation antidepressants, helping the mood, quietly hurting the heart. There's another group of medications that many adults over 60 take without realizing the hidden risks: tricyclic antidepressants, drugs like amitriptyline and imipramine. And here's the surprising part: most older adults aren't even taking them for depression. They're prescribed at low doses for nerve pain, chronic aches, or insomnia, which makes people even less likely to imagine they could affect the heart. I once treated a man in his early 70s with diabetic nerve pain. His previous doctor had prescribed low-dose amitriptyline to help him sleep and ease the burning pain in his feet. It worked. He slept better and his pain calmed down. But after just a few weeks, he began feeling dizzy every time he stood up. His heart raced. Some nights, he said, the room would darken for a second. One night, as he stood to use the bathroom, he collapsed, broke his hip, and needed surgery. When we evaluated him, we discovered severe drops in blood pressure whenever he changed position, what we call orthostatic hypotension. And the main trigger was the tricyclic antidepressant he was taking. These medications present three major problems for people over 60. First, they can cause sudden drops in blood pressure when standing, increasing the risk of falls and fractures. Second, they can raise resting heart rate, forcing an aging heart to run constantly, which is exhausting over time. Third, and most important, they can interfere with the heart's electrical conduction system, prolonging certain ECG intervals and increasing the danger of serious arrhythmias. Today, for older adults, we often prefer newer antidepressants that are safer for the heart or alternative nerve pain medications that have less effect on blood pressure and heart rhythm. If you or someone you love is taking amitriptyline or imipramine daily, especially if dizziness, fast heartbeat, or palpitations occur, please talk with your doctor. Do you still need this drug? Is there a safer option for your age and heart condition? Should you get orthostatic blood pressure checks or periodic ECGs? Next, we'll talk about one more very common medication, a bone health supplement that many people think of as harmless calcium pills. Used incorrectly, they can contribute to vascular calcification and increase heart attack risk. Conclusion: protecting the heart after 60. Isasi with knowledge, we've covered 5 very familiar groups of medications: anti-inflammatory painkillers, NSAIDs, stomach protection drugs, PPIs, cold and decongestant vasoconstrictors, tricyclic antidepressants, and even calcium supplements. The common thread is not that these medications are bad, it's that they can become dangerous for the heart after 60 when used incorrectly, used long-term, or used without proper monitoring. What I hope you take away from this video is not fear, but awareness. Never assume any medication is harmless. Always tell your doctor everything you're taking, including supplements. Ask clearly, is this drug safe for my heart at my age? If this video helped you, please subscribe, hit like, and share it with someone over 60. Their heart and yours deserves the protection that comes from understanding. See you in the next video.